Why is a drug for your waistline suddenly a threat for your eyes? What's going on?
Well, first of all, we're not sounding a loud alarm, and it is certainly a medication that we've been familiar with for a long time. Diabetics have used this medication for blood sugar management. So it's a weight management medication for a lot of people, but it's absorbed by the whole body, and certainly there's going to be an impact. We are seeing an increase in a very rare but serious side effect that it might cause ischemic optic neuropathy. So that means the blood supply is reduced or sometimes restricted to one of the optic nerves, and that can cause a permanent loss of vision. And it's not necessarily as severe in one person as it might be in another, but having your eyes examined within a year prior to being prescribed or within a month to establish baseline characteristics after you've been prescribed is something that we're recommending.
Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a great day. We have a really important topic today, and it's for those of you who are on GLP-1 or thinking about getting on GLP-1 for weight loss or any other reason. GLP-1 is a relatively new drug. It's come onto the market quickly. It's been taken up very quickly. It's very popular. However, there are some side effects that are being noticed. An estimated 12% of U.S. adults have used GLP-1 medications in their lifetime. For many patients, the drugs offer meaningful progress in managing diabetes or weight, but rare and potentially serious eye complications have also been reported in some patients. Adding an optometrist to your care team and establishing a baseline exam gives providers a reference point if vision changes occur. The American Optometric Association, or AOA, recommends that patients starting GLP-1 therapy schedule an in-person comprehensive eye exam before treatment begins or shortly thereafter, and also to get checkups during treatment. While the AOA recommends an annual eye exam for all adults, this is particularly important for those considering GLP-1. The guidance follows reports of rare eye complications in some users, and doctors say certain patients may face higher risks depending on their medical history. To talk about all this with us today is Jacquie Bowen OD. She's the president of the American Optometric Association. If you want to learn more about this, please visit AOA.org. That's the American Optometric Association website, AOA.org/GLP1. And before we get to Dr. Bowen, please subscribe to our channel so you don't miss an episode. We've got over 200. And if you're watching us on YouTube, Apple, or Spotify, please give us a thumbs up or a 5-star review if you like what we're doing. That helps us get the word out to more people. Thanks in advance. So welcome to the show, Dr. Jacquie Bowen. How are you today?
I'm doing very well. How are you, Jonathan?
Good. I'm so glad you're coming on the show. We've got this GLP-1 drug, which is being hailed as a miracle for weight loss, but the American Optometry Association is sounding an alarm. Why is a drug for your waistline suddenly a threat for your eyes? What's going on?
Well, first of all, we're not sounding a loud alarm, and it is certainly a medication that we've been familiar with for a long time. Diabetics have used this medication for blood sugar management. So it's a weight management medication for a lot of people, but it's absorbed by the whole body, and certainly there's going to be an impact. We are seeing an increase in a very rare but serious side effect that it might cause ischemic optic neuropathy. So that means the blood supply is reduced or sometimes restricted to one of the optic nerves, and that can cause a permanent loss of vision. And it's not necessarily as severe in one person as it might be in another, but having your eyes examined within a year prior to being prescribed or within a month to establish baseline characteristics after you've been prescribed is something that we're recommending.
Good. Now, is this something that was missed, or is this just kind of the natural progression of bringing a new drug on the market that's so popular?
Yeah, it's not something that's been missed. It's an observation that's been made. Optic neuropathy, the ischemic form, we've seen a doubling in patients who are taking GLP-1 medication.
Wow.
We've also seen an increase in diabetic retinopathy and progression toward wet macular degeneration. So it's rare. It is not a reason to not take the medication initially, and we're not recommending that you stop. We're just asking that you include an eye exam with an optometrist during the course of your treatment and follow the recommendations of that doctor, just to make sure that you are not a person at risk for some of these rare side effects.
Good. And who is at risk? Is there a way to tell this in advance?
When we do an exam on a person that we know is taking the medication or is planning to, we're going to assess the anatomy of the optic nerve and see if that's a riskier looking eye. We do a scan of the retina layers in the center of the retina where the vision is most impacted. So we're just looking to make sure everything is normal. That's something we do all the time. People who don't take a single medication and don't even need glasses and contact lenses should make an eye exam part of their annual medical health routine. So when a person is on a medication, we're just going to add a few more questions and a few more observations into what we assess in the first place.
Is there a specific glitch in somebody's vision that they should not ignore, that should spur them to get immediate medical attention? What symptoms should patients be looking for?
Characteristically, the most common is a dimming or a blur of the vision, usually in one eye. It's usually painless, and it might be accompanied by a lack of the vividness and colors. Or a lot of times people just notice something is off. It's oftentimes hard to describe what you're experiencing with your eyes and your vision, but we know that, we hear that a lot. And so making the call to your doctor of optometry and saying, hey, this is just kind of funny, we can take it from there and take a look and let you know everything's fine, or we're seeing a risk for this or that situation. So anything that's sudden or weird or just makes you uncomfortable, it's worth checking out.
Got it. So this puts all the onus, I guess, on the patient. But my question is, are general practitioners or online clinics getting knowledge about this? And are they starting to advise clients before they take GLP-1 drugs? Or do people really have to advocate for themselves?
Well, that's why we're thankful for opportunities like talking to you today, because this is kind of newish information. And certainly some people don't even report that they're taking this medication, even to their general physician, because there's if you have not been prescribed this medication by your family physician or whomever, if you are getting it from a website or from a weight loss center, that's okay. You just need to report that to your eye doctor, your dentist, your chiropractor. Anybody that you're seeing needs to know about the medications, because different parts of the body will respond differently to the medications.
Good. So this is really underlining a message that we've had for our audience on many of our shows, which is the importance of advocacy. Would you agree with that?
Absolutely. And don't be embarrassed. Don't be shy. You made this decision wisely, or you're looking for wisdom in making a decision. And you can advocate for yourself by being honest and being open and asking all the questions that you want to ask.
Great. So folks, if you want to learn more, you can go to AOA.org. That's the American Optometric Association. So you go to AOA.org/GLP-1. And doctor, when they go there, what will they learn?
So there's an easy to digest article there, and that'll tell you some more information about the things we've talked about today. Very importantly, there's also a doctor locator that you can click on, which will take you to where you can find a doctor in your area that will take care of you and your family long-term, whether you're on a GLP-1 medication or not.
Good. And can you distinguish for us the difference between an optometrist and an ophthalmologist, and what kind of eye doctor people should see if they are on this medication?
Sure. That's a great question, and one that's answered frequently. Optometrists are doctors who are the primary providers. We're the gatekeepers. So if something's happening with your eye that's not an emergency situation, we will take a look at it and we will help you with deciding how to manage that and connect you with specialists or other healthcare professionals for surgical or medical treatment beyond what we do. We take care of minor emergencies, injuries, some minor surgeries, and of course, vision care with glasses, contact lenses, and consultation regarding refractive surgery, all those things. So these surgeons are the ophthalmologists. If a person needs an eye surgery, an ophthalmologist is the one who does internal eye, back of the eye, injections, incisions, and long-term disease management as well. We have a very good relationship with ophthalmology, and we are happy to take care of people at the primary care level, and we engage them in the more specialized procedures that might be needed.
Great. So if you're on GLP-1, if you don't have an optometrist, it's advisable to get one to just see if you're at risk for any kind of eye disease. Are there any questions I didn't ask, Doctor, that I should have, or is there a big message you'd like to leave with people today?
The main message I always like to leave with people is that just because you think you can see well and your eyes are comfortable doesn't mean everything is fine. And that's the case with our whole body, right? So just like you would wisely have an annual physical, get your blood work checked, get everything checked out, and answer all the questions your doctor needs to know. That's true with your teeth, is true with your eyes. Eyes and vision are an important part of your life. There's a lot of things you do all day that you wouldn't be able to do if you couldn't see well, and you don't want to wait until that happens before you get your eyes examined.
Absolutely not. Your eyes are so important. Dr. Jacquie Bowen, thanks so much for being with us today. It's been great to have you.
Thanks, Jonathan.
Jacquie Bowen is the president of the American Optometric Association. She's also the past president of the Colorado Optometric Association and has been recognized with the Colorado Optometrist of the Year Award and Vision Monday's Most Influential Women in Optical. Good for you, Doctor. She's been providing eye care to the community for more than 30 years. This has been Jonathan Marx with GoToHealth. Please subscribe to our channel. If you like what we're doing, please give us a thumbs up or a 5-star review on YouTube, Apple, or Spotify. That helps us get the word out to more people. This has been Jonathan Marx with GoToHealth, and as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.